Hi, I'm Dr. William Lawrence with OrthoSports Athens in Athens, Alabama. I'd like to talk to you today about a very common issue with most adults, that is shoulder pain. I'm going to talk specifically about two of the more common issues with shoulders. Shoulder pain is very common, typically noted with difficulty sleeping on the shoulder or doing activities that cause you to raise your arm at or above shoulder level. Most of the time people will present with discomfort and they will describe it more as an anterior shoulder pain or pain into the side of the arm. The pain that runs down the side of the arm is a sign of bursitis. People can also present with pain that radiates from the shoulder to the posterior neck. We use as a rough guide to cut off as the ear. Pain posterior to the ear that radiates from the shoulder is a sign that the rotator cuff tendon has been involved. Typically when you have this discomfort, it's a rotator cuff tendonitis. I always joke with patients, this is one of the most common things we see because it is. What people notice first is that they have trouble, say, combing their hair, putting things in the shelf at home, but disruption of sleep seems to be a big problem. Some of the exam that we do is an impingement testing. Impingement is where the collarbone meets the shoulder. There's a little joint space called the AC joint. As we age, and unfortunately this can begin in people's early 30s to mid 40s, early 40s to mid 40s, the collarbone joint narrows, resulting in bone spurs or osteophytes developing at the end of the collarbone where it meets the shoulder, as well as on the acromion or the flat bone that you can feel above the shoulder. Once you get the bone spurs, it's a matter of a space issue. If you need a certain amount of space to work between the rotator cuff and the bones, if you have a bone spur, you can imagine that your space is narrowed. What that leads to is difficulty in raising your arm to a higher level. As you do this, you bump the rotator cuff and the bursa into the bone spurs. Now the bursa is just a fluid-filled sac that rests between the bone and the rotator cuff. It's basically a lubrication joint for the body, and you actually have them in several spots in the body. First line of treatment most people have done on their own before they arrive in our clinic. That is over-the-counter anti-inflammatories such as Motrin, Aleve, ibuprofen, naproxen. If these do not help, the next step is we try a steroid injection. The steroid injection is a combination of a local anesthetic as well as a steroid. If people have really limited motion whenever they see us in clinic, we will send them for physical therapy. If injections do not help, then we typically send you for an MRI for evaluation of the rotator cuff and the soft tissues of the shoulder. If you have impingement syndrome without rotator cuff tear, the treatment option best is to go with a shoulder scope. Shoulder scope is a 3-poke hole surgery, a small incision in the front of the shoulder, one on the side, one off the back edge. If there's no rotator cuff tear, we simply go in and take the bone spurs out that have decreased your space to operate between the bone and the rotator cuff. Of course, when we're there, if we notice a tear of the rotator cuff or labrum or other soft tissue structures, we can repair them as well. On a shoulder impingement surgery without rotator cuff or other soft tissue injury, the recuperation time is greatly reduced compared to a rotator cuff tear. Typically, on a shoulder impingement surgery, you can move your shoulder immediately post-operatively. It is sore. We don't expect you to, say, pitch a Major League Baseball game, but you can move the shoulder. We place you in therapy about a week after shoulder scope, be it for impingement or with a rotator cuff tear. Rotator cuff tears will extend your therapy out for at least 3 months and can take upwards of a year to completely resolve. So if you're having problems with your shoulders and would like to speak to us about it, we would love to see you. Thank you.